you are one of the millions of Americans who deal with migraines. You know how debilitating it can be. Nisha, we know.
Yesterday.
Just infuriating sometimes what happens. Did you know there could be possible permanent relief from that? And we've got almost living proof right here. We're going to see. We're still in the early stages, but we'll see. This is Cresta Cummings, and she is a Cunningham. I'm sorry, Cunningham. Cresta Cunningham.
So close.
I apologize for that. And she is a patient of Dr. Kevin Rose with the Rose Clinic. And before we talk to you, Dr. Rose, about what you did to help her out, Cresta, what were you dealing with?
I had one headache 24/7 for 6 years.
It never went away?
It never went away.
Really?
Did you just want to pull every hair out on your head?
Every day. Every day.
Well, what did you do? How did you manage?
You just learn to live with it, make the most of it, as bad as it is, and some days are worse than others.
Okay, now let's tell people the difference between headaches and migraines, because that wasn't just you wake up with a little...
No. It started out one day, I had a headache one day and thought, oh, this is kind of bad, so take your Advil, whatever. And 2 weeks later, I went to the doctor thinking there was a sinus infection or something. They treated me for that, and from there it just progressed. It never went away.
Dr. Rose, this is where you step in. What did you decide to treat her with?
Well, the wonderful thing about what I can do is I can find out if people might respond to a surgical procedure by injecting Botox. See, what we believe is that there are nerves around the head and neck area that you can target with Botox, and so what we do is we paralyze muscles that are around nerves that provide sensation to the forehead and scalp, and we paralyze the muscle, and then the nerve is no longer being irritated.
You brought a little example here, and maybe if you just leave it there so the camera can get it and point out where you do this.
So where are the trigger sites there?
Well, right now we have a few different trigger sites. We actually have come up with a fifth trigger site, which is something that's relatively new. But the main trigger sites are above the brow right here, and there's two nerves that come out through a muscle right here, which is really commonly targeted with Botox for cosmetic purposes.
I was going to say that Cresta looks really fabulous.
That's one of the added benefits, right? A brow lift? All right, so let's go.
And then there's another trigger site is in the temple, where there's another nerve which goes through the big chewing muscle right here in the temple. And then in the back of the neck, which I can't show you on a skull, of course, is down here where the neck meets the head. Essentially, there are two other nerves which come out at the base of the skull and provide sensation to the back of the scalp. And so the Botox goes in and temporarily paralyzes the muscle and takes care of the pain. And I know that if it helps them, then I can go in surgically and basically do mechanically what the Botox is temporarily doing chemically.
So you remove the trigger spot.
Right.
And are you removing nerve, muscle? What's getting gone?
There are two trigger sites where we actually take the nerve out, and the other trigger sites we actually remove muscle. So it depends on which is more expendable.
Do you try Botox in all of those trigger points initially, or one at a time?
One at a time, because my goal is to try and find out what's the least number of trigger sites that a patient has, so I do the least amount of surgery.
Okay, so how many sites did Cresta have?
She had two.
Two. And what did you do for her?
So what I did is I went in endoscopically. That means I didn't make some huge incision. And I went in from the top, just behind the hairline here and along the sides, went in and I basically removed some muscle from her forehead right through here, and also took the nerve out in the temple area. And that has done wonders for her.
So she hasn't had headaches. What if I don't have headaches, but I want Botox in all those places? Can you help me with that?
Absolutely.
Under the auspices of migraines. So, Cresta, how long ago did you have the surgery, and how do you feel now?
It was December 23rd, and I would do it again in a heartbeat.
Have you had any of the migraines since then?
No.
Nothing?
Nothing.
That 6-year migraine is gone.
It's gone.
And you're 6 years younger with Botox.
And also the brow lift. Because, Dr. Rose, didn't you you worked under Dr. Guyman, was it in Ohio or Cleveland, right?
Yes, Dr. Guyron in Cleveland. Yeah.
All right. And so how did you discover that this is what happened? How did he discover that this works?
Well, luckily, he's just a genius. And he was noticing that patients who are having cosmetic surgery for forehead lifts were noticing symptomatic relief from migraines. And then also around that same time, people were also noticing that when you got a Botox injection, for cosmetic purposes, that it was also helping headaches. And so he's an investigator, and so he investigated, and sure enough, there was a strong correlation. So we did a study and looked at 100 patients, and sure enough, you have about a 94% chance that the surgery will help you if the Botox does.
That's so great.
Isn't that extraordinary?
It is.
Anyone else doing it here in Utah?
No, I'm the only one in Utah. There are about 5 of us across the United States that do it.
So if you suffer from migraines and you think Dr. Rose may be able to help you out, this is where you find him. It's the Rose Clinic. The number is 801-375-7673, or you can go to the website, which is theroseclinic.com. We will also put that link on our website, abc4.com, and you just find us on the
Where's the clinic?
homepage. And it's down in Provo, beautiful Riverwoods. They have a gorgeous medical facility down there.
Cresta,
So,
good for you.
I know.
Yeah.
Oh, how nice.
Dr. Rose, you're saving migraines. That is for sure. There could be permanent relief on the horizon.
Good for you.